This video contains a truth that has changed the lives of many people. If you are having health problems and have ever felt stuck, please subscribe to the channel and leave a comment in the comment section so we can share useful knowledge together. Have you ever reached for your glasses, blinked a few times, and thought, why does the world look a little blurrier today? Maybe the print on the label seems smaller than it used to, or the sunlight feels harsher than before. If that sounds familiar, you're not alone and you're definitely not imagining it. As we grow older, our eyes go through changes just like the rest of our body. But here's the truth no one talks about enough. You have more power than you think. When it comes to protecting your vision, think about it. Your eyesight connects you to the world, your loved ones' faces, the beauty of nature, the books you love, your favorite shows. So what if you could hold on to that precious gift longer with a few simple habits? You absolutely can. In this video, we're going to talk heart to heart about how to keep your eyes sharp, your vision clear, and your world in focus. These aren't gimmicks or magic cures. They're real, doctor-recommended habits that you can start today. Whether you're already wearing bifocals or still reading without glasses, this is for you. We'll explore 10 practical tips to protect and even improve your eye health after 60. And don't worry, it's not about doing everything at once. It's about making small changes that add up to something powerful over time. If you have any questions about your specific condition, glaucoma, macular degeneration, dry eye, you name it, drop it in the comments. I read every single one, and I'm here to help however I can. Let's start with something that's as easy as stepping outside. Literally, sunlight. It's a blessing, but it can also be a danger to your eyes. Most people don't realize this until it's too late. But UV rays don't just damage your skin. They can harm your eyes, too. And the risk gets higher with age. Long-term exposure to ultraviolet light can speed up the development of cataracts and even increase your risk for macular degeneration. But here's the good news. Protecting your eyes from UV damage is simple and stylish. A good pair of sunglasses with 100% UVA and UVB protection can make a world of difference. Not just any tinted glasses. Look for that label and wear them even on cloudy days. Yes, even in winter. UV rays don't take a holiday. If you wear prescription glasses, you can ask for photochromic lenses that darken in sunlight. That's what I recommend to my patients who don't want to switch between glasses and sunglasses. It's one small choice, but over time, it helps keep your retina and lens safer. And if you wear a hat with a wide brim, even better. Think of it like sunscreen for your eyes. Now that we've talked about light, let's talk about what's fueling your vision from the inside out. Nutrition plays a huge role in eye health, especially after 60. Your eyes are delicate organs. They need specific nutrients to function properly and stay strong as you age. Sadly, most seniors don't get enough of them. But with just a few tweaks to your meals, you can nourish your eyes every single day. There are certain vitamins and minerals that are like superheroes for your eyes: lutein, zeaxanthin, vitamin C, vitamin E, zinc, and omega-3 fatty acids. You'll find them in colorful fruits and vegetables, leafy greens like spinach and kale, bright orange foods like carrots and sweet potatoes, and in fatty fish like salmon and sardines. If that sounds a little overwhelming, don't worry. You don't have to completely change your diet overnight. Just try adding a handful of spinach to your eggs in the morning. Snack on a few almonds in the afternoon. Have a piece of grilled salmon once or twice a week. Little steps, big results. And yes, there are supplements that can help, too, especially if you have age-related macular degeneration or a family history of it. Look for formulations with the AREDS2 formula that stands for Age-Related Eye Disease Study. But always check with your doctor before starting any new supplement, especially if you're on medications. Alright, we've talked about sunlight and nutrition. Let's shift gears and talk about something that sneaks up on people and can cause real harm if left unnoticed. Your annual eye exam is more than just a vision check. It's a window into your overall health. I can't tell you how many times I've seen a patient come in for what they thought was just a routine check, and we caught something serious early: glaucoma, diabetic retinopathy, high blood pressure, even signs of stroke. Your eyes are the only place in the body where we can see your blood vessels without cutting you open. That's why your eye doctor can catch problems before you even feel symptoms. If you're over 60, you should be seeing your eye doctor once a year even if your vision seems fine. Glaucoma, for example, is called the silent thief of sight because it often causes no pain or obvious symptoms until it's too late. But if we catch it early, we can treat it, manage it, and protect your vision for years to come. So don't skip that appointment. Put it on your calendar like a gift to your future self. Because it is. And here's a gentle reminder, if you're dealing with diabetes or high blood pressure, your eyes need even more attention. Both conditions can damage the tiny blood vessels in the eyes, and that damage builds up quietly over time. The earlier we know what's happening, the better chance we have to stop it in its tracks. So we've looked at sunlight, nutrition, and exams. That's already a powerful start. But protecting your vision is about more than just preventing disease. It's also about reducing daily strain. Now that we've taken a good look at these core habits, let's gently shift into something that's just as important but often overlooked in everyday life. Now that we've opened the door to understanding how essential nutrition and hydration are for eye health, let's walk a little further into this journey and talk about something that often gets overlooked, yet might be sitting just a few feet away from you right now. Screens. Yes, those glowing rectangles we've all grown to love. Televisions, smartphones, tablets, and computers. Whether it's catching up on the news, reading the latest mystery novel on a Kindle, or video chatting with the grandkids, we spend more time than ever looking at screens. And while they've opened new doors for connection and convenience, they're also taking a quiet toll on our eyes. Our eyes weren't built to stare at screens for long stretches, especially as we age. You may have noticed your vision getting blurry after a while or felt that irritating dry, gritty sensation. That's because blinking slows down when we focus on a screen, sometimes cutting in half, and blinking is what keeps the surface of your eye moist and comfortable. Less blinking equals more dryness, and for some people, even headaches or eye strain. Here's something simple you can try starting today, the 20-20-20 rule. Every 20 minutes, look at something at least 20 feet away for 20 seconds. It might sound like a small thing, but it gives your eye muscles a moment to relax and refocus, reducing strain and protecting your long-term eye comfort. If you wear glasses, talk to your eye doctor about lenses with a blue light filter or anti-glare coating. These don't just help with screen use. They also reduce the stress your eyes experience from indoor lighting and even night driving. And speaking of doctors, let's not forget how important it is to stay on top of those checkups. Getting your eyes examined regularly, at least once a year, becomes more important with each passing decade. Not just to see whether your prescription has changed, but to detect early signs of eye diseases like glaucoma, macular degeneration, or cataracts. These conditions often creep in quietly. You might not notice anything's wrong until real damage has been done. I once had a patient, Marjorie, who came in thinking she just needed stronger glasses. But after a routine exam, we discovered early-stage glaucoma, completely painless and with no symptoms. Thankfully, because we caught it early, she was able to start treatment right away and preserve her vision. That's the power of proactive care. It's not about reacting to vision loss. It's about staying one step ahead of it. And while we're talking about proactive care, I want to touch on something that might surprise you: physical activity. You probably already know that walking, stretching, and staying active are great for your heart and joints. But did you know that exercise also supports your eye health? When you get your blood pumping with light exercise, even a brisk walk around the block, you improve circulation throughout your body, including the tiny blood vessels in your eyes. This helps reduce pressure in the eyes, especially for those at risk of glaucoma, and supports the health of the optic nerve. It also helps control blood sugar and blood pressure, which when left unchecked, can damage the retina and lead to vision problems. Now, this doesn't mean you have to join a gym or start powerlifting. Think gentle, think consistent. If you can make a habit of moving your body every day, even just a little, your eyes will thank you. I often tell folks motion is lotion, not just for your knees, but for your vision too. Let's shift to something that's easy to overlook, but plays a surprisingly big role in protecting your sight: sunglasses. Not just for style, and not just for sunny beach days. Every time you step outside during daylight hours, even when it's cloudy. Your eyes are exposed to ultraviolet UV rays from the sun. Over time, this can increase your risk of cataracts, macular degeneration, and even skin cancer on the delicate skin around your eyes. You want sunglasses that block 100% of both UVA and UVB rays. That's the label to look for. Not all sunglasses do this, even the expensive ones. So when you're shopping, don't just look at the brand. Check the UV protection level. Bonus points if you wear a wide-brimmed hat, too. Together, they work like sunscreen for your eyes. And while we're on the topic of protecting your eyes from the outside world, here's another habit that goes a long way: washing your hands regularly. It may sound like something we've heard 1,000 times, but for eye health, it's especially important. Our hands carry bacteria, viruses, and irritants. And every time we rub our eyes, often without even realizing it, we invite those irritants right into one of the most sensitive parts of our body. I know, it's tempting. When your eyes feel dry or itchy, that automatic rub brings temporary relief. But try to resist the urge. Instead, use artificial tears if your eyes are dry, and a clean tissue or cloth if something's bothering them. And if your eyes feel gritty or crusty in the mornings, that might be a sign of blepharitis, a common eyelid inflammation that's treatable with warm compresses and gentle cleansing. Small habits like these, repeated daily, can quietly preserve your comfort and clarity for years to come. All of these tips may seem simple on their own: resting your eyes, getting a checkup, walking more, wearing sunglasses. But when you start putting them together, they become a powerful shield for your sight. And let me say this, from years of experience and from the heart: your vision isn't just about seeing clearly. It's about recognizing the face of someone you love. It's about reading a note from your grandchild, seeing the sunset paint the sky, or driving yourself to the store with confidence. Protecting your vision means protecting your freedom, your joy, your connection to the world. So don't wait. If anything I've said resonates with you, if you've been putting off an eye exam, or you've noticed your vision isn't quite what it used to be, now is the perfect time to act. And I'd love to hear from you. Drop a comment below and tell me about the vision challenges you're facing. Whether it's dry eyes, trouble reading at night, or even concerns about cataracts, you're not alone, and we're here to support one another. Let's keep going. We've already built a strong foundation together, and there are still a few more powerful habits I want to share with you. Now that we've talked about things like eye exams, screen time, sunglasses, and even staying physically active, let's explore a few more essential and surprisingly simple habits that can quietly protect your sight well into your golden years. Let's start with something you might not think about until it becomes a problem: lighting. Good lighting isn't just about making things easier to see. It helps prevent eye strain, especially when you're reading, sewing, or doing hobbies like puzzles or crosswords. As we age, our eyes naturally need more light to see clearly. What felt comfortable at 40 might feel dim and frustrating at 70. So, brighten things up. Use task lighting where you read, cook, or work. Opt for warm, diffused light instead of harsh fluorescent bulbs. And place lamps behind you or beside you rather than directly in front of your eyes. You'll find that not only can you see more clearly, you're also reducing unnecessary stress on your eyes. Next, let's talk about sleep, that beautiful, healing reset our bodies need each night. Believe it or not, getting enough quality sleep also supports eye health. During sleep, your eyes get a chance to fully rest, renew moisture levels, and repair daily stress. If you're not sleeping well, or not sleeping long enough, your eyes can become dry, red, or more sensitive to light. A helpful trick before bed: lower the brightness on screens. Avoid blue light from devices at least an hour before you sleep, and try using a warm compress over your eyes for a few minutes. It's not just relaxing, it can improve tear flow and reduce inflammation in the eyelids. Now here's a big one: managing chronic health conditions. Diabetes, high blood pressure, and high cholesterol are some of the most common health challenges seniors face. But what many people don't realize is that each of these can affect your eyes in profound ways. Elevated blood sugar can damage the blood vessels in your retina, a condition known as diabetic retinopathy. High blood pressure, it can cause changes in vision, eye stroke, or even retinal damage over time. The message is clear. Caring for your overall health is a direct investment in your vision. Keep your blood sugar stable. Take your medications as prescribed. And never hesitate to ask your doctor how your health conditions could be impacting your eyes. Because chances are, they are. There's one more tip I want to leave you with. And it might be the most important one of all. Listen to your eyes. So often, we wait until something is seriously wrong before we speak up. But your eyes are always talking to you in their own quiet way. Maybe you notice more floaters. Maybe things seem a little dimmer. Maybe night driving just doesn't feel safe anymore. Don't brush those signs off. Early detection saves vision. Every single time. Whether it's a cataract that's clouding your lens or early signs of macular degeneration. If you catch it early, you have options. You have choices. You can act. And acting isn't just about medication or surgery sometimes. It's as simple as adjusting your lifestyle, adding supplements, or using a magnifier. But none of that happens unless you trust what your eyes are telling you. Let's go over the 10 key tips we've covered in this journey together. Eat for your eyes. Focus on leafy greens, fish, and antioxidant-rich foods. Stay hydrated. Water supports tear production and comfort. Limit screen time. Use the 2:0 to 0:0 rule and blink more often. Get regular eye exams, once a year, at minimum. Exercise regularly. It boosts circulation and lowers pressure in the eyes. Wear sunglasses. Protect against UV damage even on cloudy days. Wash your hands. Reduce the risk of infection or irritation. Use proper lighting. Reduce eye strain during daily activities. Get enough sleep. Allow your eyes to rest and repair. Manage chronic conditions, because your overall health affects your vision. Each of these habits is a small step, but when practiced together, they become a powerful way to safeguard your independence, your joy, and your connection to the world. Because vision is more than just seeing. It's about living. And you deserve to see every beautiful detail of the life you've worked so hard to build. So here's my heartfelt invitation to you. Take one of these tips, just one, and start it today. Make it a daily ritual. Maybe it's drinking an extra glass of water. Maybe it's scheduling that overdue eye appointment. Or maybe it's walking outside with a good pair of UV protective sunglasses and soaking in the world around you. Whatever you choose, your eyes and your future self will thank you. And if this video helped you in any way, consider sharing it with a friend or loved one. You never know who might need a gentle reminder to care for their vision, too. Until next time, stay kind to your eyes and keep looking forward to the light.